Majority of healthcare systems in Europe try to combine, and around the world, combine private and public systems. But they have faced declines in the quality and accessibility of care for the majority of people who cannot afford the private parallel system. Please comment on how your party would ensure that we all get access to quality health care. I'll start.
The Alberta Party doesn't believe we need any more privatization of healthcare in Alberta. We do have some already, and we think that's plenty. It's critically important that we have a publicly funded, publicly accessible, publicly administered healthcare system. It's one of the foundational pieces of who we are as Albertans and as Canadians. And this is something that we heard when we went out to listen to Albertans of all political stripes in our big listen. We were out listening for a year. And over and over and over again, people told us they do not want any more privatization of health. So our party believes in building policies with the people and using the input of the people. And so that's what we've heard loud and clear. And we're not interested in any more privatization.
Thank you very much. I want to make it very clear the Progressive Conservative Party under the leadership of Premier Redford definitely does not believe in any privatization. We believe in publicly funded health care delivered in a public manner. And I think it's important to note that we need to look at some of the different models. The family care clinics that have been brought forward, access to services 7 days a week till late at night, working with other people who can deliver the services. Health promotion and wellness. We need to look at the wellness part of health, and as well as focusing on the sickness part. And let these pharmacists prescribe. So we want to let the professionals in the field do their jobs and let them assist Albertans. And again, it's about the access and making sure Albertans get the help they need and finding family doctors as well.
The Violet Rose policy on health speaks specifically about patient wait time guarantees. Our plan does not cut any money to healthcare. We already spend more than any other and every other province. We've committed new dollars specifically for patient wait times. If you're unable to meet those times here in Alberta, we will let you take the dollars with you where you can get those services. But we're not, that's not our desire, that's not our goal. But there is, I mean, we already have certainly lots of private health care in Alberta. If you want to get your teeth done or you want to get your eyes looked at, that's all private. The federal government has recently detached funding from rules, and we're going to have a whole bunch of different provinces doing a whole bunch of different things in different ways, and we'll learn which provinces are able to do best with the dollars that are allocated to them, and hopefully we can emulate that. We're not sure where that is, and I don't think anybody does.
As the party that brought in Medicare, Tommy Douglas and Woodrow Lloyd, in a major fight in Saskatchewan, we feel very possessive when we see right-wing parties moving to try to privatize it. And they always put it in a nice sort of way. It's wait times, you know. And then wait times mean more private clinics, and we're delisting services at the same time. And ultimately, when you move in this direction, as they have in Europe, as the questioner asked, is that they've developed a two-tier system, and if you get certain care, if you have the money, it's not quite as bad as the United States. But the public system has been hurt because a lot of the doctors and nurses and other health professionals can make more money in that system, and they start to move there. So that would be, it's not to say that we can't do some things within healthcare with the money that we're spending, do it differently. But the route is not to allow more privatization. That leads to checkbook Medicare. Make no mistake about that.
I think it speaks well that the only two doctors in the legislature are Dr. Swan and Dr. Sherman on the Liberal caucus. There was a PC doctor, Dr. Lyle Oberg, and didn't he go to BC? No, yeah, Sherman too. he got ousted. But Lyle Oberg did too. Lyle Oberg went to BC to start a private clinic. Isn't that revealing? And isn't he an advisor to the Wild Rose, to Daniel Smith? Very revealing. And isn't there, I mean, Heather said that the government is fully committed to the public healthcare system. Isn't there a private clinic opening up at the corner of 124th Street and 102nd Avenue? I mean, and I think you have to have at least $3,000 a year to participate in all the things that they offer. When I explained all the things that they offer to a physician friend of mine, he said, well, don't we all want that kind of service? I mean, the public healthcare system should deliver what we need. And we should publicly fund it, and it should be publicly delivered, and we should stop the privatization of healthcare in this province.